Now, and it's that time of year when we say we're getting serious about our New Year's health resolutions, but doctors say falling short can have some serious consequences like heart disease, high blood pressure, and strokes. I spoke with a Piedmont health expert to learn some smart, healthy resolution tips. Thanks so much for staying with us. One of the biggest setbacks to maintaining healthy New Year's resolutions happen when people are not seeing the results and then fall back into their old habits. And joining us with some tips here on how to keep those healthy resolutions is Tracy Gift. She's a recreational therapist at Piedmont Macon Medical Center. So first off, thanks so much for joining us. Now,
Yes.
You're a recreation therapist, and I don't know that most people know what that is. So can you kind of tell me what your role is?
Yes, my job is to help a person get back to doing what he or she loves to do. I work really closely with physical, occupational, and speech therapy, and we provide a holistic approach to getting a person back home. So my job is to help get a person back to doing what you love to do. That's what I do.
That sounds pretty awesome.
Yeah.
Kind of a nice mix of all of the specialties there. Now,
Yes.
from what you see daily, can you tell me about why it's so important for our region of the country, specifically kind of here in Central Georgia, to seriously focus on staying healthy?
Yes, here in Middle Georgia, we have a really high number of heart issues and stroke. And the risk for those that causes heart issues and stroke are high blood pressure, high cholesterol, and high sugars. And the things that cause that is poor eating habits and lack of exercising. So we see a whole lot of that in our rehab, a lot of heart and stroke survivors.
Now, I know that healthy New Year's resolutions, being healthier, honestly, usually one of the really big ones for most people, but a lot of times people, potentially myself included, maybe bite off a little bit more than they can chew sometimes.
Right.
So can you kind of talk about how to make those healthy resolutions? And I think you have an acronym for it, the SMART method.
Yes.
Tell me about that.
So it makes it a lot easier. It helps you feel more successful and stay on task. So we'll start with S. S means specific. So instead of saying something like, I just want to get healthy, you can say, I want to lower my blood pressure. That could be an example. So that would be S. M, measurable. To make a goal measurable, you would want to say, I am going to walk 30 minutes a day, 3 days a week. That would be an example. A is next. That means achievable. So you wouldn't want to set your goal so lofty that you can't achieve it. You want to focus on something that you know you can achieve. And R is for relative. You want to make it relative to you, to your values, to what you enjoy, to what is meaningful to you. So if we were going to use the blood pressure as an example, you would say, I want to lower my blood pressure. I'm going to walk 3 times a week. I am going to document my blood pressure, and I want to do this because I want to be healthier, I want to stay out of the hospital, I want to have quality life with my family and friends. And then there's T, the time. So you would say, I'm going to set this goal, whatever goal it is you choose, I'm going to set it from January to May, I'm going to reevaluate. I've been walking my 3 days a week for 30 minutes a day. I'm going to add 1 more day to the week, and I'm going to strive to do that from June through the end of the year.
Those sounds like
Does
some
that
great
make sense?
tips. Yeah, and I wish I knew those before. I kind of tried to set some resolutions earlier this year. Now, from your experience, though, what are some of those biggest factors that can often trip people up, especially maybe after they receive a diagnosis?
Right. Well, when the doctor explains to you that you may have some high blood pressure, we're going to use that as an example. What's really important is going to the doctor first and foremost, going to the doctor regularly. So when you are at the doctor and he says, you have some high blood pressure, they might put you on some medication, they might not, they might suggest to eat a little better, exercise a little more, whatever that doctor suggests. But what's more important, and what I've learned from working with so many patients in rehab, is that a person doesn't really understand what is high blood pressure. So I'm going to share that today. So what causes high blood pressure, or what is one of the causes of high blood pressure, is when we have too much sodium in our food. That makes our bodies retain water. So when our body retains water, that water goes into your blood. And when that goes into your blood system, then your blood volume becomes more. And what pumps our blood is our heart. So your heart is having to work a whole lot harder to pump all that extra fluid, and that's what causes high blood pressure. It causes extreme pressure in the blood vessels. And that is actually what is the cause of high blood pressure.
Okay. Well, also, it's so important, we know, for people to be informed and understand why and how they stay smart in their health resolutions this year.
Right.
So what's a good resource for folks to learn more about those health issues, like, say, heart issues or diabetes or something like that?
Yes. Well, of course, your doctor and your doctor's nurse is a great resource. But on Piedmont.org, we have a website. You just go to Piedmont.org, and up in the search bar, you can punch in, how can I manage blood pressure? How can I manage my sugars? How can I move more? And it will give you lots of information. So you can use that information, and you can also speak with your doctor, and that way you're able to make a good, healthy resolution that's specific, measurable, attainable, achievable, relative, and timely.
I don't know if I had the acronym down, but I do know that some of those were good tips that you were listing off there.
Yes.
Now, in case you missed it, here's the website that Tracy mentioned, Piedmont.org. That's where you can go. As she said, just type into the search bar your subject, and you can find all sorts of doctors and links to really get more information, and also maybe some tips on how to keep those New Year's resolutions sticking.
Yes.